Welcome to Big Butts No Lies. I'm Mavi, your go to guide for everything plastic surgery. With 18 years in the industry working alongside top board certified plastic surgeons, I know what really goes down: the good, the bad, and the botched. Now I work for you, bringing you real, unbiased info to help you make the best choices for your dream look. Whether you're going for subtle enhancements or a full on transformation, I'm here to give you the facts, the tips, and the confidence to navigate your surgery journey. Let's get into it. Should be fun. Hey guys, do I have the show for you today? I'm committed to bringing you both sides of the table whenever we're talking about all of the different procedures that we talk about. And today, you guys are in for a treat because I am very excited to have Dr. Abigail Rodriguez, a board certified plastic surgeon, on the show today. Hello, Dr. Rodriguez.
Hi, Mavi. I'm so excited to be here.
Thank you. I'm excited to have you. And today's topic, you guys don't even know. The topic for today is drainless tummy tucks. My listeners, I'm sure they're like, what? Drainless? Mavi's always talking about drains. So, this is such an educational episode. I want my listeners to really learn as much as they can and also help us make our own decisions on what if we want to go drainless or go with drains.
Yeah, I'm happy to help with that. I think it's always a surprise to patients to hear that drainless is even an option. So, yes, I'm excited to kind of lay all the information out there.
So on the show, I've had probably about 98% of the surgeons that I ask at the end of every episode if they're team drains or no drains. And I would say probably 98% of them say no drain or team drains. Then they've tried drainless, but they always go back to drains. So I'm really interested in seeing and hearing everything about the different techniques that you use to help patients with the drainless tummy tucks. First off, let's start from the beginning, basic,
Sure. Yeah.
right? Like, what makes a drainless tummy tuck different than a with drains tummy tuck?
Okay, so it's really kind of exactly in the name, right? So a drainless tummy tuck means we're not putting a drain. So a drain, just to be clear, is a little kind of plastic-like tube that exits the skin, and it allows a surgeon to kind of help remove the fluid that would typically build up under the tissues after surgery. And that's kind of a normal response of our body, is to put fluid into a space that's kind of been opened up with surgery. So the tube helps kind of suck the fluid out into a little what we call like a bulb. So it's kind of like a little tiny canister that fills up with fluid over time, and you have to empty it, measure how much is coming out, things like that. So it is a little bit cumbersome to have to deal with that, but it I think is necessary for people that are kind of comfortable with that technique and don't know the alternative technique of using stitches on the inside to seal off that space. Since we have to do something to either remove that fluid or prevent that fluid from building up. So I think many surgeons, like you were saying, feel more comfortable placing the drain because that's kind of been the way it's done for decades. But there's actually been a new technique around for quite a long time, like 20 years, really. So not that new to where we have to be a little like worried about it. Like, does it work? Like, we know drainless techniques work really, really well. So the difference is, rather than placing that little tube or the drain to pull the fluid out, we're going to prevent the buildup of fluid from the get go. So that involves me taking a little extra time during the surgery to place stitches on kind of like the underside of the tissue that's lifted up with the tummy tuck to seal it back down to the muscles. So that kind of seals the tissue down. It closes off the space that would have been trying to fill up with fluid. And your body kind of redirects that fluid just to the kidneys to be urinated out. So it's very safe. It doesn't cause any other kind of knock on effects with regards to the fluid. Your body can handle it very, very well.
I
So,
love to hear that.
yeah, so that's kind of the difference. I think sometimes people are a little worried, like, well, where does the fluid go? Your body gets rid of it just as it does with any other type of kind of swelling. So
I'm super curious what your protocols are for massages if you are not doing drains. Do you still have patients do lymphatic drainage massages?
Yes, I do. I think it is helpful for the swelling, because we oftentimes are doing liposuction of adjacent areas or even of the upper part of the tummy itself. And so I think it's helpful to get swelling down, but also to really like soften the scarring that is inevitable under the tissues. So I think that to me is the kind of most powerful long-term effect, is to get everything softened so it feels more comfortable and looks as smooth as possible. So I prefer to wait several days before starting the massages after surgery, because I have found that patients sometimes are a little too like their body's still in a delicate state, and sometimes the massages can be a little too intense if we start straight away, like the day after surgery. So I usually say wait about 4 days, 5 days, something like that, to get started. And usually I recommend for this kind of surgery, like a drainless tummy tuck, to do maybe 2 or 3 hand lymphatic massages a week.
I want to ask you something, and I always like to talk about with the show we always interview different surgeons, and I love doing that because my listeners gets to hear different opinions. Everybody does. I tell them I could ask 10 surgeons to draw a banana, and they're all going to draw a banana, but they're all going to look different, and everybody has their different techniques. So I love to hear your techniques. And for patients who are listening, or somebody who's listening who might be considering an abdominoplasty and they've just been afraid of the drains, they don't really want to mess with them. I know they've been hearing of drainless abdominoplasties and how those work. What do you have? Okay, my question is this: is there a specific type of patient that would qualify for a drainless as far as their BMI? Like, does their BMI have to be below a certain threshold for them to qualify for you to do drainless versus with drains?
No. So if I think a patient is a candidate for a tummy tuck at all, they are a candidate for a drainless tummy tuck. So I think every patient gets a drainless tummy tuck, at least in my hands. So I think it's totally doable and it's safe to do, really, regardless of the BMI. As you know, we want your BMI to be in a healthy range, right? So I have a cutoff of 32 for this type of surgery, but any patient, whether their BMI is 17 or 32, would be a drainless tummy tuck.
Okay, so are you listening? Are you guys listening? If you've been thinking about it and you're just like, "Oh, I don't know, I'm on the fence." I'm really excited for you guys to hear Dr. Rodriguez's take on the drainless tummy tuck. One of the other things I always like to talk about is how you decided to become a plastic surgeon and kind of your origin story.
Yeah, sure. Well, I think the first of all, I was kind of going on a different track. I was going to become a OB-GYN, and specifically I wanted to do gynecologic oncology. So I was like very focused on that. And I didn't really consider plastic surgery. I was like, oh gosh, I couldn't get into that. That's so competitive. And my mom just encouraged me, 'cause she's a physician too. She encouraged me like, hey, just like take an elective in plastic surgery, learn how to stitch really well. It'll benefit you, in any field you go into. And so I took her advice, and I'm really happy that I did, because I was introduced into this, subspecialty, this whole other world within surgery, and I fell in love with it. And I think one of the things that really stuck out to me in the operating room was a surgeon in a different specialty said, when we don't know what to do, we call a plastic surgeon. And I think that totally encompasses like what we're all about. Like, we're problem solving surgeons. So there's no like cookie cutter answers to anything. We have to kind of customize our surgical plans in every case. So I don't know. I just loved it from the get go.
I love it. I love to hear it. Another thing that I saw on your podcast form was something about your rapid recovery regimen. And I would really love for you to educate us on what is a rapid recovery regimen.
Sure, yeah. So I think in the medical world, the formal name for it is ERAS, or it's an acronym for Enhanced Recovery After Surgery. And so I've taken a lot of the kind of core tenets of ERAS and sort of distilled them down into things that I think are really important for patients undergoing aesthetic surgeries. And so we incorporate that into every patient, that's having a surgery with me, whether it's a breast surgery or tummy tuck or what have you. And so that involves using pain medications, but really avoiding narcotic or opioid medications that have a lot of bad side effects and, as everybody knows, are addictive. So we really help to kind of avoid the side effects that come with those medications. So that's like nausea, constipation, feeling drowsy. So the more we can avoid those and rely on things like anti-inflammatory medicines, high dose Tylenol, things like that, it allows you to feel comfortable, so your pain is controlled, but also not be like super sleepy and drowsy. So you can get up and you feel like getting up and walking around earlier. So you kind of get that forward momentum going. And I think that really helps to accelerate your recovery after surgery. So I think that's a big part of it. Encouraging people to walk early after surgery is a big part. And I also will start those non-narcotic medications before we even do the surgery. So your body is kind of prepared for what it's about to experience, with the operation. So that's kind of like the medicine side of it. The other portion that I think is really important, that's not something that is easily studied as like the medications are, but is kind of like how we handle the tissues during surgery. And I really think it is important to treat the tissues with respect and be very, very delicate with them. And so I try to do that for my patients. And I think it makes a difference because they seem to have, less swelling, less bruising, and seem to recover faster, whenever we're kind of really taking care to avoid pulling too much or pinching the skin too much. So I think that makes a great difference too.
I love to hear it. So, for our patients or for our listeners who are thinking about a drainless tummy tuck, what kind of what would be the difference in their post-op care versus a traditional tummy tuck?
That's a great question. And I think the difference is you get to avoid all of the annoyances of having a drain, So I think in reality, what it looks like having the drain or drains, some people put a couple or what have you after surgery. So if you have the drains exiting the skin, you typically have to pin them to your clothes or kind of take care of them to make sure they don't get tugged on or something like that. And like I mentioned before, you have to empty the drains, measure how much fluid comes out. Sometimes your family member has to do that for you. They're a little grossed out, or, so I think it introduces a whole other level of, having to deal with this like medical stuff that some people just aren't comfortable with. So you get to avoid that. You get to avoid having to come back for like additional appointments to have the drain removed. It's a little uncomfortable to have the drain taken out sometimes. So all of that just goes away. So yeah, that's the benefit, is not
That
having to deal with all that.
I love it. As far as like wearing their garment or any of the other things that come along with a recovery from a tummy tuck, everything's still the same?
Yeah, yeah, and I think the swelling actually seems to be a little bit less intense. I think it makes sense in my mind that we're kind of, sort of quilting the tissue back down to the muscles, so it doesn't have as much sort of capacity to kind of balloon up with swelling. So yeah, I think it's actually the same, if not maybe a little better.
Oh, I love to hear it. So, for my listeners who are considering a drainless tummy tuck, there you go. I brought it to you. You guys can take the information and decide which way you want to go.
And I think one thing that I'll mention, because a lot of people are like hesitant, and some surgeons say, like, oh, you have to put a drain. Like, there have been numerous studies that we've done comparing this exact thing, like a tummy tuck with a drain or a tummy tuck without a drain. But whenever we're not putting a drain, we're doing something extra always. We're putting those extra stitches on the inside. And so the complications that we see after these surgeries, with regards to like fluid building up under the skin or like a seroma, is actually the same or less with the drainless technique. So I think it really works. It's safe and it's tried and true. Like I said, it's not a new thing.
I love it. One of the other things that you have that you wrote down as far as something you wanted to talk about today. And I want you to tell us all about it. And that's your partnership with AVDA. Why don't you tell us a little bit about what that is and how it all got started?
Well, yeah, so I'm super excited about it. This is something that I have been wanting to do for several years. And it just took me some time to, be in a position to have the time to do it and also find the right organization to try and partner with. And I think AVDA is a great one. So it stands for Aid to Victims of Domestic Abuse. They help both men and women that are victims of domestic abuse navigate through the court system. So they supply them with attorneys, paralegals to help with that process, which can be very emotionally taxing, but also just overwhelming because where do you start? So I think it's a great, well-run organization, and their leaders have been really responsive to me, trying to partner with them. And so the idea was, and I've seen patients come in already just for consultations here and there where they have sort of this physical sequela of, uh, physical abuse in the past, so scars that they have incurred from abuse or, things like that, that really are triggering and reminding them, all the time of what they went through. And so I think it can be very helpful and powerful to try and, we can't ever erase a scar, right? A physical scar, but we can make it better. And so my thought was to partner with them and, offer my services to any of their clients that might be interested. So that's the idea and that's the vision. So we're really kind of in the infancy stages of getting this partnership organized. But I think that's what we can hope for and expect, hopefully, like later this year.
That's so beautiful. I love to hear it. I think this is a perfect opportunity to. I always brag about my plastic surgeons on the show. I'm always telling my listeners, when you're looking for your surgeon, you really want to look for a board certified plastic and reconstructive surgeon. And I know there's a lot of versus going to a cosmetic surgeon.
Yeah.
So one of the things that I like to highlight is how plastic surgeons, you said it before, are the problem solvers. And one of those cases that I have seen in person of a domestic violence patient was a patient who came in with a fractured orbital bone. And the plastic surgeon that I was working with at the time fix that. So, for my listeners, I think we've talked about plastic surgeons doing breast reconstructive surgery where they turn a tummy tuck into a breast mound and different things like that. But we've never talked about something like an orbital bone fracture. Who do you call? You
Yeah.
call the plastic surgeons.
Yeah, exactly. Yeah, we operate, head to toe. So we're super versatile, and I think a lot of what the skills that I have can hopefully help a lot of these women and men, that are just not happy because they see something on their body that reminds them of that bad experience.
Absolutely. So why don't you tell us what are you really excited for that's coming down the pipeline? I know we have two things we talked about that
Yeah.
are kind of on the horizon, and my girls, my listeners, they love to hear it.
Yeah, so one of them is called Alaqulín, and this is a product that it's fat cells that are coming in syringes. So they're super concentrated, purified fat cells that you can buy, open a box, and take it out. And so what that means is we can use that to do a fat transfer, fat grafting to an area without having to do liposuction. So it helps us avoid having to do maybe a procedure that you weren't like necessarily wanting. Sometimes we just need to get fat from somewhere. So for patients that need a little fat for an area, so say you have like a little maybe indentation or perhaps at the breasts, if you're very thin and there's a little rippling of your implant, it may be really helpful in that kind of situation. Because it's almost like a filler injection. You can just come in, inject it, and then kind of walk out. It's not a full surgery. So that's really kind of exciting. I think it'll.
Super exciting. My skinny BBL girls are probably jumping up with joy right now.
Yeah. Well, I think it's pretty costly though, so I don't know if we could do, it would have to be kind of tailored to the situation and to
For
see if it's
sure.
the right thing. But, in situations where you have like hip dips maybe, and you're super thin, that might be a good option.
And this is new. We haven't ever had anything like this, right? In on the market.
Yeah, so it's super super cool. And then the other one that we were kind of talking about is tiger mesh, which is something that they've been using for breast reconstruction regularly for years now, and it seems to have a very good safety profile. And the place where I see it kind of coming into play in aesthetic surgery would be for breast surgery, but in situations like a breast lift or in revision cases where we have really difficult um, kind of a difficult time controlling where the implant is situated and positioned. So in those situations, it can be helpful. Galaflex, as I'm sure you know, is something we use really regularly. One of the, I guess, kind of difficulties with it though is sometimes it's a little bit firm. It can feel a little hard, and this is a lot more pliable. So it's very strong, but feels kind of a little softer. So it might be a good option for a lot of patients.
I love to hear it. We're always talking about kind of what innovations are out there to our listeners who may be dealing with something that they had a consultation for a few years ago and we didn't have anything for it then. Like, for example, Alaqulín. Maybe they were thin and they didn't have any fat to graft. Now, this is kind of opening some doors
Yeah,
for my skinny girls.
yeah,
I know, I know they're just so excited, even if it is a little costly for
yeah.
my girls who are like, I don't have any fat.
Yeah. Yeah, it's a good option. And, I have one patient that, we've already switched out her breast implants to make them less ripply and all this, but there's still a little, and I was like, hey, this is the perfect situation for alloclay. So yeah, I think it'll have a great utility in aesthetic surgery.
I love to hear it. So, Dr. Rodriguez, I've really enjoyed your time on the show. I think you've taught us and my listeners a lot about drainless tummy tucks and what's coming out with the newest technologies on the market. Before I let you go, I always ask this, but I already know your answer. I always ask it before you go, but so we have a poll. Whoever's keeping track, make sure you keep track of Dr. Rodriguez's answer. The question is, are you team drains or no drains?
No drains.
No drains. Y'all heard it.
I mean, for tummy tucks, that's a no-brainer. I mean, I think you could maybe make an argument for some other surgeries where it is a little more important, but no, I think we got other techniques that make it so we don't have to use those anymore.
I love it. And if my girls want to come see you for a drainless tummy tuck, how can they find you?
Yeah, so I'd encourage everybody to follow me on Instagram and TikTok if they're not already. And my handle is Dr. Abigail Rodriguez, and my website is drrodriguez.com. Super easy.
Beautiful. So, you guys, you heard it here. If you're looking for a drainless tummy tuck, you have Dr. Rodriguez to go see. She's here in Houston, so y'all can stop by and visit me while you're here. With that, I will see you guys next week. Thank you for being on the show, Dr.
Thank
Rodriguez.
you, Mavi. I appreciate it. Good talking with you.
Bye. Thinking about plastic surgery, but you don't know where to start? I've got you. With 18 years in the industry and experience working with top board certified plastic surgeons, I help women like you make informed and confident decisions. Whether you need help choosing a surgeon, planning your recovery, or understanding what to expect, I've got your back. Skip the guesswork and get expert guidance by booking a call with me today. That's a wrap for this episode of Big Butts No Lies. If you found this episode helpful, do me a favor and subscribe, leave a review, and share it with a friend who's considering plastic surgery. Until next time, stay confident, stay informed, and remember, big butts don't lie.